Members, it's the appointed time and we have a quorum. Let's invite the government officials to enter, please. Agenda item number 2. Well, according to the Legislative Council brief submitted by the administration, the Department of Health and the Health Bureau have met with different stakeholders since February last year, consulting them on their views with regards to the Dentist Registration Amendment Bill 2024. And the Secretariat has received 3 submissions from the public. Well, people around me are suffering from COVID, and I think that inviting deputations to a public hearing is quite dangerous still. So I recommend that the Bills Committee invite the public and the 18 district councils to give their views via written submissions. And the written submissions received will be sent to members for reference and the administration for a consolidated reply. Any comment? Dr. Lam, please. Chairman, I think that a lot of students and industry practitioners are affected and they want to come to the Legislative Council to give their views. They can write to us. I think that they want to come to the Legislative Council. Which group are you referring to? I'm talking about students in the dentistry program. You mean that the students who are studying in Hong Kong U? I think that other dentist groups would like to give their views at the Legislative Council, directly to the Legislative Council members. How many of them would like to come? I think that only the representatives would come. I'm worried about having too many deputations at the Legislative Council. Chairman, I think that having public hearing is very important because this is a very important piece of bill. A lot of dentist group and students, well, I don't think that any bill would be more important than the legislation or legislative exercise for Article 23. We received over 10,000 written submissions for the legislation exercise for Article 23. I don't think that we should spend a few days on the public hearing for this bill. What do other members think? Chairman, I think that apart from industry practitioners and students, other members of the public are concerned about the bill as well. If we can have a public hearing for the public to give their views at the LegCo, I would think that that is a good thing. As mentioned by Chairman, no bill would be more important than the legislation for Article 23. If we could handle that for the Article 23, I don't think that we cannot handle this bill. Well, of course, we can handle the the dentist registration bill, but I'm worried about the COVID situation. Chairman, perhaps we can set some rules asking the public deputations to wear face masks, for example. Ms. Lam So-wai. Thank you, Chairman. I hope that we can have a public hearing for this bill because we have the same arrangement for other bills as well. I know that we are having another wave of COVID, but as mentioned by other members, we could ask the deputations to wear a face mask. Because this bill is related to public service, community stakeholders, people with chronic illness attach importance to the bill, along with the industry practitioners. Well, let's have a public hearing in due course then. I would like to welcome the Dr. Libby Lee, Undersecretary for Health, Ms. Elaine Mack, Deputy Secretary for Health, Mr. Ronald Chang, Principal Assistant Secretary for Health, Mr. Herman Law, Assistant Secretary for Health, Dr. Kitty Che, Consultant Dental Services, Ms. Maria Chow, Secretary of the Dental Council, Ms. Phyllis Ko, Deputy Secretary of the Dental Council, Ms. Selena Lau, Senior Assistant Law Draftsman, and Ms. Janice Leung, Government Council, Department of Justice. When we come to paragraph 6 of the chairman's brief, let's come up with a time for the public hearing. Do you think that is too tight of a schedule if we have a public hearing next week? Administration, I think that you have a PowerPoint slides for the presentation. That is CB bracket 4488/2024 bracket 01. Undersecretary, thank you. We're having a manpower crunch in the dentist trade. According to the Healthcare Manpower Projection 2023, the shortage of dentists is at about 150, and I think that the situation will only become less significant towards 2040. As said, 1st of January 2024, we have a vacancy rate of about 27%, which undermine the dental care service of the government. The government has been attaching importance to the shortage of manpower. The dentist registration ordinance have been in place since 1959, which stipulates that a dentist that can only be registered having passed the licensing registration examination administered by the Dental Council Hong Kong, DCHK. And we have on 4 occasions increased the number of UGC-funded first-year, first-degree places from 50 to 90. That is up for 80%. And the DCHK has increased the frequency of the licensing examination to 2 times a year. And we don't still have enough dentists. That is why we need to provide new pathways for admission of qualified, non-locally trained dentists. And otherwise, the public dental service provided will be affected, especially for those for the underprivileged. We will explore different ways to increase the number of dentists in Hong Kong. For example, providing for new pathways for admission of qualified non-locally trained dentists. Through this amendment bill, the government will review the regulatory regime for auxiliary dental workers and to provide or enhance the service quality of the dentist in Hong Kong to better serve the members of the public. In light of this, since February last year, we started the public consultation sessions, which lasted for a year. We met with DCHK dental professional bodies, partners of the government's dental service program, staff and students of Hong Kong U Faculty of Dentistry, associations and training institutions for ancillary dental workers, hospital authority, and patients groups. And we reported the bill to the panel on health services on 2 occasions. The bill has the support of the community. The bill has been submitted to the Council for the first reading on the 10th of April. Now I will talk about the objectives of the bill. First, we will broaden the pathways for dentist registration. We will introduce this scheme of legitimate registration, LR, and special registration applicable to specialist dentists. For non-locally trained dentists, as long as they secure employment with the Hong Kong U, the Hospital Authority, Department of Health, or the Prince Philip Dental Hospital, they can apply to be employed at the said institutions with the DCHK. As long as they have worked there for at least 5 years and have satisfactory performance, they can migrate to full registration. After registration, they can practice in any institutions in Hong Kong. For temporary registration, that's to facilitate professional exchange, to allow dentists in other jurisdictions to conduct or perform clinical teaching and practice for no more than 14 days in Hong Kong, and they cannot migrate to full registration. And we'll also introduce this provisional registration. We ask the dental students to go through a period of internship and assessment before they can be fully registered in Hong Kong. This is in response to the DCHK and the trade comments, and they said that we need to have the students accumulate enough experience in the real-life settings to enable them to better adapt to the practice of Hong Kong. And this practice of internship and assessment has been in place for medical officers, and we are working with the Department of Health on the details of the internship, and the students of the dentistry program have participated in the setting of the details. This arrangement of internship will be in place regardless of the manpower supply. The internship and assessment arrangement will be applicable to the dental graduates in the class of 2024 or 2025 in order not to affect the students in their final year who will graduate in 2024. For the regulatory registration for the dental care professionals, we're talking about dental hygienists and dental therapists. We will introduce a statutory registration system to ensure their service quality under a more formalized regulatory regime. The term ancillary dental workers will be retitled to dental care professionals to establish their professional status. According to the interim report devised by the Working Group on Oral Health and Dental Care, it is insufficient to merely rely on dentist workforce to meet the needs of enhancing dental care services, and we need to have ancillary dental workers to play a more significant role in dental care service. Under the principle of risk-based, we will broaden the scope of work that the dental care professionals can perform and the conditions under which they can do so. There are some duties that the dental care professionals can only perform with the supervision of dentists. Hopefully, the statutory registration system for dental care professionals can be established within 3 years after passage of the bill, which will then enable dental therapists to work outside the Department of Health. Also, there will be a requirement on mandatory continuing professional development for dentists and dental care professionals. Also, we will have other technical amendments to, for example, redefine the term practicing dentistry so that it will be up to date. This is the first time we amend the DRO in 16 years. Now I will invite Mr. Chang, Principal Assistant Secretary, to give members a presentation to facilitate members' understanding of the bill. Thank you. Mr. Chang. Thank you, Chairman. Now, I will talk about the objectives of the bill. As it covers a very wide scope, we will be implementing the provisions at different stages. First, we will be creating new pathways. As mentioned by the Undersecretary, there are currently 2 pathways for registration for locally trained and non-locally trained dentists to practice in Hong Kong. We would like to introduce this limited registration and special registration to introduce non-locally trained dentists to practice in Hong Kong. So as long as these non-locally trained dentists secure employment, that is full-time employment with the Department of Health, Hospital Authority, Hong Kong U, or the Prince Philip Dental Hospital, they can apply to practice in those institutions for a maximum of 3 years, and that may be extended by the DCHK, and they may migrate to full registration. For limited registration, That's for the locally trained dentist to go for internship, and that's for assessment of non-locally trained dentists as well. For temporary registration, non-locally trained dentists can apply for such registration for short-term exchange for a maximum of 14 days. For the conditions of limited registration, we've made reference to the similar practice of the doctors. First, these dentists have to be employed by a specified institutions or other institutions specified by Secretary of Health, or type of employment determined promulgated by DCHK. Sometimes the government allow non-locally trained dentists to practice in Hong Kong, for example, rugby sevens. Second, the dentist will have to obtain a qualification outside Hong Kong, which is recognized by DCHK, and the dentist have to have adequate and relevant full-time post-qualification clinical experience. Registered as a dentist under the law of practice outside Hong Kong has not been prohibited by DCHK from taking a licensing examination. Well, because if a same person has failed the licensing examination for more than 5 times, they will be barred from taking another examination. Also, this non-locally trained dentist should be of good character.
As the Undersecretary said, we want to have specialist dentists registering for special registration. So there are only minor differences from limited registration. They have to be awarded a fellowship from the Hong Kong Academy of Medicine, HKAM, in specialty of dental surgery, or certified by HKAM as having achieved a professional standard equivalent to that for the award of HKAM fellowship. Be it special registration or limited registration, these dentists can migrate to full registration as long as they have engaged in one or more specified institutions for at least 5 years in aggregate, and they have been certified by every institution to have satisfactorily served with reference to DCHK's criteria. Right now, there are 3 parts to the licensing examination. Part 1, written test. Part 2, practical test. And Part 3, clinical test. Right now, for these people on limited or special registration, they can have part or all of their licensing examination exempted. But this would be on a case-by-case basis. Once they have taken the parts that they have to take, they can be eligible for full registration, and they can serve in Hong Kong providing dentistry services. Temporary registration, for this we have referred to the arrangements in the MRO Medical Registration Ordinance. The applicant must satisfy the Dental Council of Hong Kong that the other person is coming here exclusively for performing clinical teaching or research for the applicant. As for the internship and period of assessment, it is an arrangement to enhance dentists' professional standards regardless of manpower supply. And for medical practitioners, it's the same. Regardless of a demand, we still have an internship arrangement in place. We want to enhance clinical experience of local dental graduates or non-locally trained dentists in real-life settings. And through such arrangements that have made reference to those in medical registration ordinance, the dental graduates or non-locally trained dentists would need to complete internship or period of assessment. They have to rotate through different positions in community special dental services, general dentistry, hospital dental service, and school dental care service. Seeing those that are about to graduate would have already been looking for jobs, we are looking to apply these arrangements to local dental graduates in class of 2025 and thereafter. As said earlier, we have referred to the arrangements in the Medical Registration Ordinance. We have provided a professional registration mechanism. For local dental graduates, they would have to undergo a 12-month internship, and for non-locally trained dentists who pass the licensing examination, they would have to go through a period of assessment. This can be extended by the Dental Council of Hong Kong if the performance is less than satisfactory. These people can work in the Department of Health, Hospital Authority, or other institutions specified by the Secretary for Health. Upon completion of the internship or the period of assessment, they can receive a certificate of experience, and then they will be entitled to full registration. The third part of the bill relates to the enhancement of regulatory control over dental care professionals. Before, dental hygienists are required to enroll only once under existing law. They are currently employed in both public and private sectors. They are to perform preventive dental care. As for dental therapists, they do not require statutory registration or enrollment at the moment. They are only employed by the Department of Health to serve persons under 18 in school dental care service. They will perform preventive dental care and certain curative dental care. We want to introduce a statutory registration system to regulate both dental hygienists and dental therapists. These people, after the introduction of the system, will still have to be engaged by registered dentists or partnership, organization, establishment, or body corporate with registered dentists, as in current practice. We will suitably relax the scope of work on a risk-based approach to allow them to play a bigger role in dental care. Basically, we will allow them to take over the non-invasive work such as teeth polishing that they can perform independently. When it comes to taking radiograph, we will require examination by a dentist in advance. For scaling, filling, extraction, for example, these procedures would require dentist examination and presence in the same premises in order to provide assistance to the dental care professionals if necessary. Right now, we have dental therapists undertaking certain duties in education, for example, in school dental care service. With this mechanism, if they are proved to have competence, they can also provide scaling, filling, extraction with the supervision of dentists. These arrangements are to implement within 3 years after passage of the bill, enabling dental therapists to work outside the Department of Health. The next part would be about mandatory CPD. This would become a mandatory requirement for renewing practicing certificates. This will be undertaken in phases. This will first apply to registered dentists. Once the regulatory controls for dental care professionals come in place, this will also be made applicable to them. We will also change up the composition and structure of the DCHK. We will have members increase from 12 to 24 and lay members increase from 3 to 9. We will also have the preliminary investigation committee to be more than one if necessary to process complaints and disciplinary proceedings more efficiently. We will also make statutory the examination committee and the CPD committee. We will also introduce a new committee, the health committee, to deal with physical and mental fitness issues of dentists to make sure they are competent to provide dental care services. As we said earlier, there has not been any comprehensive amending of the legislation for many years. We will make some technical amendments as shown here in the slide. That's it for my report. Thank you. Alright, if colleagues have no other comments to make, We will discuss the policy matters of the bill. Please press the request to speak button if you wish to speak. Depending on how many members wish to speak, I will set a time limit. We have 10 members who would like to speak. I'll read out the order in which members are going to speak. Professor Chen Wing-Kwong, Mr. Chen Han-ben, Ms. Lam So-wai, Mr. Lam Chun-sing, Dr. David Lam, Reverend Peter Kun, Mr. Tang Fei, Ms. Judy Chen, Ms. Lillian Kwok, Mr. Holden Chow. 5 minutes per member, questions and answers included. But please observe the time limit and allow enough time for the administration to answer your questions. Please do not repeat the questions either. Professor Chen Wing-Kwong. Thank you. I support the amendments. We have in place different registration mechanisms, and we would require those registering would have adequate clinical experience. Why not set an actual number of years instead of just saying it to be adequate? Also, for those migrating to full registration, they need to go past 2 stages. 1, they have to be certified by institutions to have provided satisfactory dental services. If the dental council is not satisfied, is this a subjective assessment? We should have gatekeeping in place to prevent any corruption. It is also said that one would have to pass a clinical part of licensing examination. Right now, with non-locally trained dentists, they have a very low passing rate at the moment for the licensing examination. For those that cannot pass one or the other parts, what is the passing rate at the moment? With a low passing rate, will it affect the incentives or the motivation of non-locally trained dentists to come practice in Hong Kong? Thank you. Thank you. What is adequate? That would be determined by the DCHK. The DCHK would set a set number of years of experience. For example, we are discussing the details at the moment. As for whether the performance is satisfactory, this is in line with the arrangements of other professional associations in the medical field. The performance, whether it is satisfactory, would have to be determined by the institutions. And in the end, when the licensing examination is administered, we can see whether the dentist is indeed performing well in clinical settings. The second stage would relate to the clinical examination, or actually the third part. There are 3 parts. Actually, 50% of the practitioners would pass the third part of the test, so it's not too bad. And we consider this clinical part to be very important because it really showcases the dentist's performance in real-life settings. So we think this is necessary. But if non-locally trained dentists are very experienced, they have practiced many years overseas, for example, this clinical part can be exempted as well. So this clinical part can be exempted. Yes, it's for specialty dentists seeking registration through the special registration mechanism. I also want to ask, how will you prevent any bias or corruption? This is very important. Well, thank you. Specified institutions would be the Department of Health, the Hospital Authority, or any institutions specified by the Secretary for Health. They will also adopt the criteria set by the DCHK. Thank you. Mr. Chen Han-ben.
Thank you, Chairman. I'm glad to see the amendment bill because 2 years ago, Ms. Starry Lee and I came up with this blueprint on the formulation of a dental service policy and development over the next 10 years. I'm glad that some of our suggestions have been included, and we're finally reforming our dental care services. Through limited registration, special registration, and the inclusion of dental care professionals in some scope of the work of dentistry, I think that we can improve our services. I have 3 questions. First, for limited registration, the Secretary for Health can specify some institutions. I know that a lot of NGOs on the market are providing dental care services, but they cannot identify enough dentists to perform these services. And sometimes the clinics have to close off when some dentists have to take leave. Now, it is mentioned that the Secretary can specify certain NGOs as specified institutions so that they can hire dentists with limited registration. For training, I know that is undertaken by the Hong Kong U mostly. Will we allow other universities to train dentists? I know that there are a lot of universities that want to open a medical school at the Northern Metropolis. Will we allow those universities to provide training for dentists so that it's not limited to Hong Kong U? For dental care professionals, I know that the government is identifying training institutions for this group of professionals. Can we expedite it? Third, on timetable. For public dental care services, I hope that we can increase the quotas to more than 4,000 so that it's not limited to a tooth extraction for the senior citizens. Do we have a roadmap to improve our services? Thank you, Undersecretary. Thank you, Chairman, and thank you, Mr. Chan. As to whether specified institution can hire dentists with limited registration, and as for whether we can allow for other institutions to hire limited registration dentists, we will have to see if they have enough supervisors and if they will follow the standard set by DCHK for assessment. We will not rule out the possibility that some NGOs may fulfill such requirements. As for if we will allow for a second dental school for dentists, well, because we don't have manpower, we don't have sufficient manpower today, and it's not enough for us to have more school places. And the fastest ways to solve the manpower issue is to introduce new pathways for non-locally trained dentists. We have 90 UGC-funded first-year, first-degree places in Hong Kong. If we need to open a new school for dentists, it would be rather expensive. You talked about dental care professionals and if they can be trained in places other than Hong Kong U. We're working with the Vocational Training Council to see if they can provide training for dental care professionals. Hopefully, we can have more dental care professionals in the future. This bill is rather complicated. Say for the statutory registration system for dental care professionals, it will take 3 years. And as for internship arrangement or assessment arrangement, it will be in place in 2025. There are still other details that we have to work out. For example, for internship, we have to set the salary level and the location of work. Hopefully, we can start the internship assessment arrangement in 2025, and that we can have a statutory registration system for dental care professionals by 2030. I think that the member is talking about universities or local universities that will be opening medical school in Northern Metropolis to see if they can be included as an institutions to provide training for dentists. I don't think that he asking you about the timetable for the implementation of the bill. I think that the member is saying that we don't have enough service quota in the public healthcare settings. He's asking when you can increase the service quota in the public hospital for dental care. Am I correct, Mr. Chan? Yes. I would like to ask the administration when they can increase the service quotas in the public hospital. Chairman, I think that you have rationalized my questions, and I want to see if we can provide dental training or training for dentists in the Greater Bay Area. If our local universities have campus on the Greater Bay Area, can they provide training for dentists there? And will we be recognizing the qualifications of students who study dentistry in the campus on the Greater Bay Area? Well, CHK have a campus in the mainland. Chairman is correct. For the recognition of qualification, well, that's different from registrations issues. Well, for graduates of a student studying on the Greater Bay Area, they can, well, their qualifications will be recognized and they can go for limited registration. Deputy Secretary. In end 2020, the administration set up this working group on oral health and dental care. And in end 2023, they published an interim report. In 2024 and 25, we will be rolling out new quotas to improve our dental care services. As mentioned by the member, for public dental care services and emergency service, we will be increasing the number of service points and service quota for people in need of emergency services. The increase in service points and service quotas will happen by 2024-25. So other than going for outpatient service, people can go for NGO to receive such kind of service. We're working on it, and hopefully we can have these extra service points and quotas very soon. I think that the member is asking this. After the passage of the bills, you will have more dentists. Do you have a timetable to increase the scope of your dental care service? Thank you, Chairman, for allowing me to follow up on my questions. I don't want to speak for a second round because I have another meeting. This is a blueprint for 10-year dental care service or dental care service for the upcoming 10 years. I'm talking about emergency dental care service. That's not just about tooth filling. It could include oral examination, scaling, education. Public care, dental care service should not just include extraction. This would not be comprehensive enough of a dental care service. People queue outside government clinics to see a dentist because we don't have enough quotas. The administration said that they will engage NGOs to provide dental care service, but I think that the people want to know when they will have more service quotas and when they can have their dental care service improved. I hope that after passage of the bill, the people would be able to benefit, and they would like to know when they can benefit. Undersecretary, for the working group on oral health and dental care, they've had multiple meetings to review the dental care service comprehensively. There will be new initiatives that will be rolled out by the end of this year or next year to benefit not just people in need. Our new initiatives also cover students aged 13 to 17 and for people with autism and people with intellectual disability. We will be expanding our service progressively, and the working group meet once every few months, and we will have another meeting in April. I ask the members to be patient. Hopefully we can roll out the suggestions as set out in your blueprint. Well, that blueprint was prepared by DAB. If you ask me, I would have a 2-year blueprint. Although I don't go to the government to enjoy dental care service, I think that we can discuss that in the panel meeting. We allow the government more time to improve the service gradually. We don't need 6 years to have more dentists in Hong Kong by having this new pathways. If we have more dentists, then we can provide more service. I don't think that you need 10 years for your reform. Next, Ms. Lam So-wai. Thank you. I support this dentist registration amendment bill. I would like to follow up on a few points. We will be putting in place this internship and assessment arrangements. But it's said that the internship arrangement will only be applicable to local dental graduates in the class of 2025. Now, asking the students to go for a 1-year internship, will that affect dental students? Should we not apply the requirement to incoming students only and leave the current students alone? Now, as mentioned by other members, shouldn't we expand the scope of dental care service to include preventive dental care on top of remedial dental care? There are a lot of children, SEN students, people with chronic illness, deprived families. They need public dental care service. Perhaps we should also include NGOs to provide dental care service, to have, for example, mobile dental care vehicles and booths. In Shatin and Mangshan, Saikong, they have a lot of villages and rural areas where a lot of senior citizens, people with visual impairments, they have mobility issues, and sometimes it's not easy for them to visit government clinics. If we can have mobile services, that would benefit them. Third, regarding internship, I wonder under what circumstances would the students have their internship exterminated. I am afraid of going for the doctor or dentist. We need to instill confidence in the people. So I would like to know about the assessment criteria for the internship. How would the students be considered failing the internship? For expensive dental care, we need high-quality dentists. Lastly, I know that we want to increase the annual UGC-funded first-year, first-degree places, but just as I read yesterday on the media reports, a lot of people go on to the mainland to see dentists. We have GXX and other institutions. Are we overestimating the demand that we have? Because we have a lot of people going for dental clinics on the mainland already. It costs some 1,000 to 2,000 for us to see a dentist on the mainland. I went to Hengshan to replace my wisdom tooth. It cost me only 1,000 to 2,000, for example, but I spent some 10,000 in Hong Kong. Will there be an imbalance of demand and supply?
第一個問題同
Undersecretary, thank you. I will answer the first and third questions regarding the internship and period of assessment. For the current students, whether they're not prepared for this, so whether we should make it applicable to them. We have heard from stakeholders that they want students to have more clinical experience and they can really make use of their skills in a clinical setting. In fact, in many different jurisdictions, we have internship arrangements for dentists, and we also have internship arrangements for medical practitioners. We think it would be too late if we wait until all of the current students graduate. That's why we decide to make the arrangements applicable to class of 2025 and beyond. Regarding the criteria for whether one can pass the internship or the period of assessment, we have been engaging the relevant stakeholders, including Department of Health, Hospital Authority, as well as dental professional bodies to devise the criteria. We must have some sort of criteria and have the relevant dental graduates and dentists pass the criteria in order to ensure patient safety. As Ms. Lam said earlier, we did observe a gap in dental care services in Hong Kong. We can do better in terms of preventive care, and we think with dental care professionals, we can meet that gap. We can perhaps devise arrangements such as what you suggested, having mobile dental clinics. As for whether we have overestimated our demand, we have to implement more primary dental care services in Hong Kong. We also have arrangements to make projections for the demand in healthcare every few years. With an aging population, we think there is still a significant demand for dental care services in Hong Kong, and we still have a manpower shortage. I want to know more about something. For medical graduates, they would need to study for 6 years and then they have to go through a 1-year internship. The arrangements that you have here are the same. But for medical students, it is different because they have many different fields. For dentistry, it would just be the teeth. So is it possible to expedite the dentistry program to have 5 years of study and then 1 year of internship so that it would still be a 6-year program? It is as Ms. Lam so wise said, when the current students enrolled, they have expectations to only study for 6 years and then they can go into a work setting and earn an income. Now their plans may have been thwarted. So is it possible for you to liaise with the University of Hong Kong to see if they can compress the program to 5 years for at least the current students, so as to not disrupt their plans? I do support that there should be internship arrangements, but I think you can compress the timeline. I think you may not be able to answer this question right now because we do not have any representative from the university here. Chair, in fact, we did consider this option, but we consider the fact that there is much content to cover within the 6 years of the dentistry program at the moment, so it may not be feasible. Thank you. Ms. Lapson-White, do you have any follow-up questions? I believe they have answered all your questions. Well, I want to know if there will be an imbalance between demand and supply. I don't think so. As you said, many of those in Hong Kong have gone to the mainland for dental care services. We also have increased the student places. I think we do not have to worry about the fact that there is inadequate demand. With more dentists, we should be able to provide more services, and people will try to take advantage of the services in Hong Kong should they be available. And I think what you're asking, the rest would be outside the scope of the bill. Thank you. Mr. Lam Chun Sing. Thank you, Chair. I think there is indeed a shortage, but not so much in the private sector, but in the public sector. We are less 100 dentists. Well, we only have a 20% short. But if we are to expand services, we may have even more of a shortage. Indeed, Chair. And as I observed, many dentists having worked in the Department of Health for a decade or so, they will move on to the private sector. That's why all along there has been a shortage in the public dental care system. Has the administration reviewed, therefore, the Department of Health's remuneration package to make sure these talents can be retained? I'm worried that while you can introduce more dentists to work in the Department of Health, after 5 years, after they have migrated to full registration, they will just move on to the private sector, just as the dentists working in the public health care system right now. And that would be a vicious cycle where we have to introduce even more dentists. That will in turn increase the total number of dentists in Hong Kong. And if we have more people going to the mainland to seek dental care services, in fact, elderly persons can make use of health care vouchers in certain dental care institutions in the mainland at the moment. It will just cause more problems with the imbalance of demand and supply. I want to follow up on Ms. Lam So-Wai's question on internship and period of assessment arrangements. This arrangement will enhance standards, of course, but for current students, if you have to make changes to these graduating requirements, these will definitely thwart their plans, and they have very different expectations before. You have to make sure that they can proceed as expected. If they cannot pass the internship pass the internship arrangements, this will be detrimental to their plans. So will you consider pushing the introduction of this arrangements back a few years so that these arrangements will only be made applicable to the new students? I also want to ask about dental therapists. At the moment, they can only work in the Department of Health. I imagine they have a heavy workload. I suppose they work in the school dental care service and civil servant dental clinics mostly. If you allow them to work in the private sector, is it the case that most of them would move to the private sector instead, causing a shortage of public dentists or dental therapists, and then impacting the school dental care service? This service is actually very important to students. It provides educational services to them. I want to know more about the manpower plans of the Department of Health in future. Thank you. Thank you. I'll let Dr. Ho answer the question about how to retain talents in the public dental care system. Right now we have 370 dentists and we have 100 vacancies. And up to 2027-28, we will have 58 dentists reaching retirement age. So it's not just a short-term manpower shortage. It will be a long-term manpower shortage if we consider the retirement wave. With the internship and period of assessment requirements, we have those in mind because we need to ensure patient safety. We have to ensure those who are about to graduate will have the standards required to provide adequate care for patients. We in fact want to implement the arrangements right now, but we do not want to affect graduates graduating this year, which is why we have chosen to have these arrangements to be applicable to the class of 2025 and beyond. And let me emphasize this, while they are working as interns, they will still be entitled to receiving an income. For dental therapists, they have been working in the dental Department of Health indeed, but they do not work in civil servants dental clinics. They only work in the school dental care service to provide services to persons under 18. With training, they in future will be able to provide services to persons age 18 or above. We do expect certain dental therapists to move on to the private sector. We have taken this into consideration. That's why we have increased the number of training places for dental therapists. Dental therapists must first undertake training for dental hygienists. That would be 2 years, and then they would need to work for another year before they can become dental therapists. For dental hygienists, there is not much of a career ladder. We hope to provide a career path for them by imposing regulatory control, and that's why we have put in place the arrangements in the bill. Thank you.
Dr. Hui, we have rolled out a series of measures to retain talent in the Department of Health. we ask the retired dentists to come back to offer service and extend the retirement age of certain dentists beyond 60 years old. For incoming dentists, we're having a full year recruitment. For dentists who have been working for a number of years, we will be according them with a certain number of extra points in the pay scale so that they enjoy a higher salary. We've exhausted all the ways that we have to retain talents. Next, Dr. David Lam. Thank you, Chairman. I would like to thank the administration for the 6+1 measure or 5+1 measure. By setting the last year of study as the internship, we changed the years of study from 5 to 6 previously for a dentist. That's complementary with the changing of secondary school system from 7 to 6 years, and the number of years for university study has been changed from 4 to 3, or 3 to 4 years. If you ask me if 6 years of study of dentist or medical program is enough, well, if you ask me, 30 years, even 30 years would not be enough. It's more important for us to have practice in a real-life setting. Now, we don't have an internship arrangement for dentists, but for medical practitioners, we do have an internship arrangement. But actually, that's the same for most countries over the world. In other countries, they mostly have an internship arrangement for doctors, and they don't have internship arrangement for dentists. So this is not really an apple-to-apple comparison that you're making. Just now, the Undersecretary said that we have to ensure the safety for patients. That is why we have to put in place internship arrangement. And you said that there was an imminent need to put in place such an internship arrangement. But according to the paper, it is said that the DCHK and Hong Kong U both support the arrangement of internship, and DCHK said that there was an imminent need to put in place internship arrangement. I wonder why suddenly we have this imminent need. Is it because the graduates of Hong Kong U do not qualify and to become a dentist? If that's the case, should we ask the graduates this year to go through internship? If you think that it's only better to have an internship arrangement, why can't we postpone the arrangements to the incoming students instead of applying them to students who are currently in dentistry program? We don't have dentists in the public healthcare settings instead of the private settings. We don't have that many vacancies on the private sector. While a lot of people are not going for dentist in Hong Kong, instead they're going to the mainland. And I wonder why we should include NGO as a specified institution. Instead of saying that we don't have enough dentists in the public healthcare setting, we should say that the government is not actually offering enough dental care service to the members of the public. We do have dental care service for the children and the elderly, but we don't have enough service for the middle class. You're only offering services to the civil servants, and you are blaming the dentist for not having enough service for the members of the public. That's because you don't engage enough dentists to provide public healthcare service or public dental care service. And I wonder why you don't encourage public-private partnership instead of including NGOs as a specified institutions. Undersecretary, from the imminent need of putting in place internship arrangement, well, we have made reference from the DCHK's evaluation and the response from the trade. We know that the graduates really don't have enough practical clinical experience. We want to encourage them to be trained in real-life settings. For students without internship experience, they wouldn't have come across difficult cases. For example, performing tooth extraction for people with intellectual disability. Dentists in the private sector would not perform such service on persons with intellectual disability because they have to go through anesthesia. We want the dentist to come across difficult cases such as the one I just mentioned. And we need to have students to go through such an exposure. For doctors, if you've never worked in the gynecology, you wouldn't thought of becoming a gynecologist. We need to expose our students to different areas. Some students are inspired to become a surgeon because they have had certain experience when they are going through internship. You mentioned why we don't apply the internship arrangement to the graduates in the class of 2024. That's because some graduates have already identified a job, and if we ask them to go through internship, that would affect them to a very great extent. That is why we only apply the internship arrangement to students in the class of 2025 to ensure patient safety when these graduates have become registered. Well, you ask why we don't encourage public and private partnership. For us to achieve such kind of partnership, we need to ensure that there is such a room in the private sector. And the reason why the waiting time for dental service during COVID is so long is because we don't have enough dentists in the private sector as well. And we also have to ensure financial sustainability. When we go for a public and private partnership, we have another measure. Well, we will include NGOs to provide such services. We will not rule out public-private partnership, but we want to focus on what we have. We will work with the DCHK. Thank you. And the Hong Kong Dental Association. I hope that the members will not focus on the supply of dentists and the number. In the colonial days, the government did not establish a dental school. Perhaps we should not dwell in the issue. To ensure the quality of dentists in Hong Kong, we need to put in place this internship arrangement. The Department of Health is not the organization to determine the curriculum of students in the dentistry program. Perhaps we can see if we can turn the 6th year of study into internship so that current students don't have to extend the years of study that they have to go through. Next, Reverend Peter Kun. Thank you, Chairman. I would like to follow up on the internship issue. Unless there's major incident or reasons to prove that the graduate is problematic, otherwise we would not change the criteria for graduation. I think that putting in place such internship arrangement that will undermine the confidence of the graduates or dental students, because they may think that the dental graduates without internship experience is problematic. I think that's the reason why dental student groups want to come to the LegCo to give their views. For limited registration and special registration, well, I remember seeing dentists graduating from the Philippines when I went to the clinics when I was young. Has the arrangement changed? Chairman, just now, Undersecretary, Dr. Lam said that the medical practitioners in other countries have to go through internship, but dentists in other countries also don't have to go through internship. It seems that our current practice is in line with that of other countries, and I did not see or hear your response to this question. Thank you, Chairman. Thank you, Reverend Peter Kun. Let me answer the question that I missed out on. In other countries, well, there are a number of countries that require their dental graduates to go through internship. For UK, when dentists are working in NHS, they have to go through a foundation year before they can take NHS cases. For Australia, they planned to put in place an internship arrangement, but because of limited resources, they abandoned the plan. But in most places, they want to enhance the skills of graduates whenever possible. The difference between dentists and medical practitioners is with skills. Dentists need a high level of coordination between eye and hand. That is why it's important for them to have clinical experience. So you want someone to have experience in tooth extraction before graduation. And that is why it's very important for the graduates to have supervision when they perform such treatment or procedures. Well, prevention is always better than cure. When the DCHK assessed the curriculum of the universities, they told us that students don't really have enough practical clinical experience. And the sector and the trade told us that the graduates really don't have enough clinical experience. So before a major incident happened, we want to enhance the experience of our students. That will perhaps undermine the confidence of the students, but that's for the good of everyone. What about the questions on the Philippines? Well, that's a very good question. Previously, prior to 1998, all Commonwealth country registered dentists can come to Hong Kong to practice without having to register with us. But, well, back then, about 50% of the dentists are non-locally trained. But in 1992, we introduced this licensing examination. Since then, all non-locally trained dentists have to go through this licensing examination. That's not limited to dentists, but also medical practitioners. This examination arrangement was introduced in 1992. There was a friend of mine who graduated from DBS who became a dentist having graduated from other places. In the 1970s, my dentist graduated from the US. So when we were young, we received service from dentists graduating from other places.
Mr. Tang Fei. Well, let me clarify something. I understand that the Undersecretary talked about Commonwealth countries, but those graduated in the US or Philippines, these aren't Commonwealth countries. Now, getting back to my questions, I think we should have more dentists because right now civil servants do not get enough public dental care services. Also, in many jurisdictions, medical practitioners, including dentists, would have to work in the public healthcare system to accumulate experience. And then they can move on to the private sector, perhaps work in private hospitals or open their own clinics. It's not just in Hong Kong, it happens everywhere in the mainland or overseas. We think we have enough private dentists. We just don't have enough in the public healthcare system. If we are to introduce new pathways to admit non-locally trained dentists, I'm more worried about whether they can actually stay in the public healthcare system. For limited and special registrations, they have to be engaged full-time in specified institutions. Will the Dental Council first devise a list of non-local qualifications that they will recognize or at least they know of, so that specified institutions will have a reference when they try to engage non-locally trained dentists? If you have all sorts of training institutions included, that may affect the quality. But if you have too few of them, we will not be able to have enough dentists. We have dentists trained in the mainland that are actually very proficient. In fact, from what I know, we have dentists who have studied at Zhongshan Dental University come practice in Hong Kong, but there are only very few of them. It's just 10 of them, from what I know. If you have a Hong Kong student who have studied in top-notch dental training institutions in Hong Kong, in the mainland, and once they have accumulated experience, do they really have to go through all the internship or period of assessments arrangements again? Won't that affect their motivation? They may be interested in coming to Hong Kong, but they may be disincentivized by these arrangements. Has the government made assessments to make sure these high quality talents will be encouraged to work in Hong Kong? Thank you. Right now, most of the public dental care services are operated by the Department of Health, and as I said earlier, we have 100 vacancies. That's why some public dental services have been affected. We do therefore want to introduce the bill to introduce new pathways for admission of non-locally trained dentists. For non-locally trained dentists who want to come to Hong Kong, they have to take the licensing examination. The passing rate is unfortunately quite low at the moment because there are 3 parts to the examination, and it is indeed quite stringent. We believe with some relaxation in the requirements, we will have more dentists who would want to come work in Hong Kong. The Dental Council never devised a list of non-local qualifications for dentistry
because we are not trying to introduce a list of qualifications for specialty qualifications. We're just talking about general qualifications. As long as the dentistry programs are 4 years in duration, we will allow them to register for limited or full registration. We did hear people who are interested making inquiries, especially those who have studied overseas and want to come back to Hong Kong to practice. Thank you. All right, Ms. Judy Chen. Thank you. I welcome the amendments. We observed before Hong Kong citizens would have to wait a long time for public dental care services. Otherwise, they have to go to the private sector and they may not be able to afford the high fees. To retain talents, Dr. Tse said that they would try to retain the talents after these dentists have reached retirement age. How many do you expect that they will stay in the public dental care system after they retire? Will you consider postponing the retirement age? That's my first question. The Undersecretary mentioned the introduction of non-locally trained dentists, and the administration has gone to the United Kingdom to recruit dentists. They plan to recruit 100 people, but they have received a very positive response. Over 300 of them were interested. How many non-locally trained dentists do you expect that will come upon the passing of the bill? On DCHK, they have functions expanded, and therefore the composition has the members increased from 12 to 24. On preliminary investigation committee, it is said that it will only be established if necessary. Once we have more dentists, I believe there may be more cases to handle. Is it the case that there will be a high threshold for the establishment of a preliminary investigation committee? If that is the case, I hope it can be lowered because we do want to facilitate complaint handling. Let me also say this. I agree with what the Undersecretary said. There is a need for internship arrangements to be put in place. But let me speak from the perspective of a dentistry student. If I have to study in another year out of the blue, it can feel very aggrieved. One can feel very aggrieved. So will the Undersecretary or the Secretary for Health consider postponing the application to classes who are starting after the passing of the bill? I also understand that for those under professional registration, they can have their internship or period of assessment extended or shortened. Is there a maximum period of extension? And how much can the period be shortened? Can you elaborate so as to provide more details for citizens' reference? Thank you. On how to retain those who are about to retire, I'll let Dr. Tse answer the question. As for whether we have any targets set for introducing non-locally trained dentists, we want to fill all vacancies in Department of Health at minimum. So that means we would want to introduce at least 100 dentists. Yes, 100 dentists, right? Yes. As for complaint handling, we're just providing for the mechanism that we can establish more than one preliminary investigation committee if necessary. We do want to also introduce more lay members and other members in order to ensure objectivity. As for whether the application of internship arrangements can be postponed, as I said earlier, we want to ensure patient safety. While students are working as interns, they will still receive an income, and we have put in place rotation arrangements for these dentistry students to work in different settings. They will work in elderly dental care services. They will also work in school dental care services. They will also work in hospitals. We consider these arrangements to be beneficial to students as well, so we want to make them applicable as soon as possible. As for non-locally trained dentists on limited registration, for non-locally trained dentists taking licensing examination will put in place after they have passed the licensing examination a period of assessment requirement, and depending on the experience of the non-locally trained dentist, the period of assessment can be shortened to a very short one by the dental council. It would be on a case-by-case basis, and it would be determined by the dental council. Thank you. Dr. Zhe. Dentists who are planning to stay after they retire, we have right now 20 of them who have stayed, and they would consist of general dentists as well as the more senior dentists. For those who have entered the civil service after the 1st of June 2015, they already have their retirement age postponed to 65. Ms. Lillian Kwok, thank you. In paragraph 11, it is said that the assessments of specified institutions will be made by the supervisors in the institutions. If the performance is considered satisfactory, a report can be written to the relevant authorities, and some parts of the examination, the licensing examination, can be exempted. The exemptions will be determined by the dental council. Now, while I understand there is a need for exemptions, but can we retain the clinical part of the examination so as to gauge the performance of dentists? I also want to ask about the specific arrangements for the licensing examination. For those taking Part 2 and Part 3 of the examination, they need to undertake the examination in either Cantonese or English. Can the option of Putonghua be added? We are a part of China. We have a lot of top-notch mainland dentists who want to work in Hong Kong, and we have some very top-notch students studying dentistry in Hong Kong. Can we facilitate their undertaking of the examination? I also want to ask about the licensing examination implemented by the Dental Council. Candidates cannot take all three parts in one go. They have to take the parts step by step. Even with 2 examinations conducted per year, it will prolong the period that students would have to take examination. Can you expedite this? I also support the legislative amendments. I also support internship arrangements being put in place for dentistry graduates. I understand the concerns of students, but the administration can perhaps explain to them that this is necessary and perhaps seek support from them in order to provide enhanced services to the public. Thank you.
Undersecretary. Thank you. Regarding whether DCHK has the final say on whether the limited registered or special registered dentists can have parts of their licensing examination exempted, while the final decision lies with the DCHK. In most of the cases, these non-locally trained dentists have to go through the clinical tests. Second, regarding the licensing examination, currently, candidates can opt for either Cantonese or English. We will see if there is a need to introduce Putonghua as a medium of examination. We have a number of mainland candidates who come for the license examination. We have 300 candidates who go for Part 1, 200 going for Part 2, and 100 going for Part 3 of the licensing examination. So we don't think that they have a language barriers. If these mainland trained dentists want to serve the local public, it's better for them to speak Cantonese. As for the seamless transition of the license examination, well, we have 2 examinations per year. They can go for Part 2 immediately after completing Part 1. But I think that people need time to prepare for each part of the exams, and it would be very stressful for a person to go through all 3 parts in one go. And we need to allow candidates time to prepare for the next part after going through a part of the examination. And all these 3 tests are very different. For Part 1, we have MC questions or multiple choice questions. For Part 2, it's a practical test. It could be an oral examination. For Part 3, it's a clinical test. So the 3 parts of the examination are very different, and they have to make different preparations. Well, for the 2 examinations that you have, you offer all 3 parts. Is that correct? If you offer all 3 parts of the test in a licensing examination, perhaps you can allow the candidates to go through all 3 parts in one settings so that they don't have to go through, for example, Part 1 and Part 2 in the first year and Part 3 in the second year. Perhaps Ms. Chow can take the question from the Dental Council. The candidates can take all 3 parts of the test in one sitting. So the candidates can go for all of the 3 parts of the examination in one sitting. After passing Part 1, they can go for Part 2. So as long as the candidate have passed Part 1, they can go for Part 2 and then Part 3 of the examination. Chairman, I would like to clarify this. So I can go for Part 1 and Part 3 in a single setting. Is that correct? Yes. If the candidate has passed Part 1, they are qualified or eligible to take Part 2 and Part 3 of the exam. So for Part 2 and Part 3 of the test, you have 2 times of the test per year. Yes, because Part 1 is held in a month, and then Part 2 and Part 3 is held in the next month. Next, Mr. Holden Chow. Thank you. I support the amendment bill. Grassroots people in Hong Kong have great demand for dental care service, and they sometimes have to wait or queue overnight at the government dental clinics. And now the arrangement has been changed, and people don't have to queue outside the clinics overnight. But we still have a manpower issue. A lot of members are concerned about the arrangement for non-locally trained dentists. But I would like to ask about The enhancement of the role of dental hygienists is mentioned in the bill as well. I have a few questions. According to my understanding, there are some 600 dental hygienists in Hong Kong. They perform scaling and education work, and they have to carry out these duties in the supervision of, or under the supervision of a dentist at all times. I talked to some dental hygienists, and they told me that because there will be a statutory registration system for dental hygienists, for scaling service, for example, they wonder if they will be able to perform this service of scaling independently. Will there be more flexibility for dental hygienists that are more experienced? For Canada, they have some 30,000 dental hygienists. They can perform scaling independent of a dentist. Can we take the middle ground to allow dental hygienists to perform scaling service independently? If we can allow qualified dental hygienists to perform scaling service independently, that would alleviate the manpower issue that we have. I know that the statutory registration system for dental care professionals will be put in place within 3 years after passage of the bill. That's to enhance the quality of the trade. I think that's necessary. And dental hygienists have to go through CPD courses for renewal of licenses. Will you have measures to support them so that they can take these CPD courses more easily in order to renew their licenses? My third question. I know that there will be 24 members under the DCHK, but most of the members are dentists, and there's one lay member to be appointed by the chief executive. Will you include representatives of dental hygienists or dental therapists to the composition of Hong Kong or DCHK so that they can voice their opinions for the formulation of dental policies in the future? Undersecretary, thank you. We will review the scope of duties of the dental care professionals. Dental hygienists can perform some duties independent of a dentist, for example, oral examination, polishing, fluoride application. For duties that can only be performed in the presence of a dentist, it's taking radiograph. For service relating to gum or in-depth investigation, they have to be performed in the presence of a dentist and under the supervision of the dentist. You talked about CPD. Well, DCHK will help them with the training, so you don't have to worry about that. As for the 24 members of the DCHK, compared to present composition, the number of lay members have increased to 9. They could be dental hygienists or dental therapists. We believe that the 9 lay members would include dental hygienists or therapists. And we have increased the number of industry practitioners or the number of lay members to 37%. Well, you said that you consider dental hygienists and therapists lay members. They are industry practitioners. We do have an answer to the question. For lay member, we're referring to people who are not dentists. Even doctors are considered lay members. You mentioned that the DCHK would be organizing CPD courses. Will you include courses offered by overseas institutions so that dentists can take courses overseas to satisfy the CPD requirements? Is that possible? Undersecretary, well, the DCHK can approve of such a course on whether or not they satisfy the requirement for CPD. Next, Ms. Elizabeth Quat. Thank you, Chairman. I'm glad to be able to scrutinize both the medical and dentist registration bill in our term in the Legislative Council. We've not been reforming the DRO in decades. We don't have enough dentists in Hong Kong, and that's a problem that's been troubling us for so many years. Apart from a manpower shortage in the public sector, we don't have enough dentists in the private sector either. That's why the fees charged by private dentists are so high, and that's also why people opt for services on the mainland, because they have to wait for a long time to see a public dentist, and the price of the private dentist is so high. That's why we have to create new pathways to include non-locally trained dentists in our local workforce. I'm glad to see that we have new pathways for admission of non-locally trained dentists by introducing this limited registration system, and we will be expanding the scope of duties of dental hygienists and dental therapists so that they can provide service independently. I think that this will be very beneficial to our local dental care service. I would like to commend the amendment bill, and I support it. Does the administration have a roadmap now? We have a vacancy of some 20%. I don't think that filling these vacancies would be our ultimate goal. If we can actually introduce non-locally trained dentists to Hong Kong, that would enhance our public dental care service. But do you have a timetable for that? Well, in the short term, we want to solve our manpower issues. After that, what kind of new service would we provide for the members of the public, and how many more dentists do we need for that? Do you have a roadmap for the next 3, 5, or 10 years? So that we can assess the demand that we have for dentists. And also, we'd like to know what kind of new service you want to provide for the people, so that we know what service we can enjoy in the future and how many more dentists we can have in Hong Kong. How many dentists do we need in the private sector, and where do they come from? Do these dentists come from the public sector? How many dentists will move on to the private sector from the public sector? Well, dental service is very expensive, and they have to spend tens of thousands of dollars to treat their teeth. Not a lot of people want to go to the mainland to receive dental service. They only go there because they cannot afford the same service in Hong Kong. I hope that you can give us a roadmap so that we can see what the future is like.
好，唔該晒主席。
Undersecretary, thank you. The questions asked by Ms. Elizabeth Court are quite complex. With the manpower of medical practitioners and dentists, we have to consider the target group for the services provided. And we have a positioning for public healthcare services. The working group studying this will issue a last report at the end of this year. We want to practice preventive care, and we can maintain health, oral health or general health with this. But we also have to take into account the needs of some special groups. We do see gaps in our services at the moment. For example, school dental care service only goes up to primary school. We have nothing for secondary schools. And we want to meet gaps like these. With the health manpower projection, we conduct this every few years. Last time, we talked about how there is a manpower shortage, but with such a serious shortage, we cannot meet the service gaps. So that is why we want to amend the ordinance to introduce new pathways for admission of non-locally trained dentists. This bill is therefore very important in the enhancement of our services as well as our expansion of scope of services. I cannot say for sure what target we should set in order to meet the service gap, because we did say before we need more people to meet even the shortage. We said earlier we're 100 dentists short, but it's actually more than that because some of the dentists no longer practice in Hong Kong. Some have reached an age where they don't want to work anymore. And there are different specialties, for example, orthodontics. We still have a lag in progress in the expansion of such services as well, and we'll need more manpower for that. We believe the change will be dynamic, but right now we need at least 100 dentists. Well, I understand that most people would try to retire at 60. Alright, next, Ms. Jovi Chen. I understand that this is a comprehensive amendment exercise because the ordinance has not been amended since 1940. I advocate often for elderly dental care service, and the Undersecretary said they would be one of the target groups. We have been doing well in school dental care service. The interim report issued by the working group said that the school dental care service should be extended to those in secondary school. While I do support this, I think we should prioritize dental care services for the elderly because we cannot promote preventive care with elderly persons. We really need to tackle the problem of manpower shortage in order to provide adequate services to elderly persons. I want to ask, is it possible to build a path to provide more elderly dental care services with the legislative amendments? The bill would introduce new pathways for admission of non-locally trained dentists, as well as regulation for dental care professionals in order to have them work independently for certain services. These can meet the short-term shortage, but in the long term, we really need to have more dental students. According to the Healthcare Manpower Projection 2020, it is said that the shortage will persist until 2035 and beyond. With the regulation of dental care professionals, we can meet short-term manpower shortage, but as I said earlier, the long-term manpower shortage has to be dealt with. We need to increase the number of places for the UGC dentistry program. Over a decade or so, it has increased by 40, from 50 in 2008 to right now 90. But this is still too few, even with such a significant increase. We cannot control the factor of how many dentists will actually practice in the public sector. What we can do is increase the number of student places to increase the base. Can the Undersecretary do something in this regard so as to make sure we have the ratio imposed by the World Health Organization? We don't have adequate dentists in order to meet that ratio at the moment. Are there any plans of the administration that will try to meet that expectation for the ratio? Thank you. Undersecretary. For elderly dental care services, we do have services for elderly persons at the moment, but we will see if we can enhance such services in future with more dentists. We do not rule out the possibility of increasing the number of student places either. We just consider introducing non-locally trained dentists to be a quicker solution. We have put in place a period of assessment requirement, and that should create a buffer. In the meantime, we can also consider whether we can increase the number of student places. Thank you. Ms. Nixon Lam. Thank you. I support the legislative amendments. I think that will respond to the needs of the public. And then we can also have services enhanced so as to shorten the waiting time for the public. That's why I support the amendments. I have some suggestions about the details of the bill. I do observe a problem. I have seen before a specific NGO that would provide dental services to those with special needs. For ordinary persons, we have to wait a long time for public dental services. For those with special needs, for example, with mental health needs or those have intellectual disabilities, they even go less frequently to dentists. They may need, as said earlier, general anesthesia just to have their teeth inspected. That's why most dentists are not willing to provide services to them, because it would prolong the time of appointment for these individuals. It saddens me that this is the case at the moment, but this is very much real. Will the administration consider imposing certain requirements on dentists to make sure they will provide services to those with special needs, so that they understand that as dentists they should serve these individuals as well, and how to deal with problems that may arise when treating these individuals. On children, I understand that some children when they have some acute dental illnesses, they have to be treated right away, but public dental care services would take a long waiting time, which is why they went to the private sector as well, went to the private sector instead. But the fees are very expensive. Will you have any assessments to make sure this problem can be alleviated, if not resolved? We would need some roadmap because these people need such services urgently, and we also have to consider the needs of those who have special needs. I also understand that there will be changes made to the composition of the members of the Dental Council. Is there any change with the division of work? Thank you. Undersecretary, thank you. The questions of the member are very much valid. For those with special needs, especially those with mental illnesses, they are very unwilling to receive treatment. And these people would often take advantage of services operated by the Department of Health at the moment. It is exactly as you said, private dentists are not as willing to treat these people because it would take much time to treat them. With the internship arrangements in place, we will have dentistry students work in such services. Essentially, that would open their eyes to see that there is indeed a group of people with special needs that they should also treat. We will also consider devising a timeline for services to be provided as suggested by the member. With the division of work in the Dental Council, we have introduced some new functions of the council, especially with the establishment of the Health Committee. It would be a committee that would evaluate the physical and mental fitness of dentists. We have an aging population. That's why we also have aging dentists. That's why we want to have a health committee that will monitor the fitnesses of dentists. We also have the CPD committee. We also have the examination committee. The CPD committee will look over the CPD arrangements. The examination committee will look over the licensing examination, as the name suggests. We also have the preliminary investigative committee. Right now we have one, and we can establish more than one if necessary to expedite complaint handling. Thank you. I can see that Dr. David Lam wishes to speak for the second round. We will leave it for the next time. I'll let Mr. Dennis Leung ask your questions if your questions are not complex. I will extend the meeting by a bit. We have to end soon because we have the council session. Are your questions complex, Mr. Dennis Leung? No. All right, please go. Thank you. Thank you. I am concerned whether the Department of Health can engage dentists in the medium term and long term in order to meet the needs of civil servants. Will the administration review the benefits package of those working in the Department of Health? If there is no review, dentists may just move on to the private sector and there will still be vacancies in the public health care system, resulting in a chronic shortage. I think the government should really attract talents to stay in the Department of Health. I observed that a friend of mine left because there was a heavy workload and they were injured on duty due to an issue at work. So this leads to my question: how will the administration consider providing support should colleagues of the Department of Health be injured at work? I also understand that regulatory controls will be imposed for dental care professionals. It is very important to have them provide preventive care, but right now the government is not promoting preventive care enough. Will you promote preventive care in schools in order to enhance awareness so as to not waste medical resources? On the structure of dentists, it is very important to impose the CPD requirement. I see some of the dentists very willing to learn. They want to learn about the new technologies. They want to digitalize the patient records and so on. For certain dentists, due to resources constraints, these technologies can be quite expensive. Will the government provide more support for dentists so that they can make use of such technologies, because they are not willing to introduce technologies at the moment due to resource constraints? I also understand that acupuncture has been used in dental treatments to minimize pain. We can perhaps have the government provide more support to introduce these methods of treatment and technologies to this sector, because right now the costs can be prohibitive. Also, if you allow dentists to work in the mainland or allow dental services to be operated on the mainland, that will cause a dent in demand. Will there be any plans of the administration on that? I'll let Dr. Jie answer the question on the relevant parts of the Department of Health. I'll answer the question on education.
無論係學前
Education is very important. We promote dental care for pre-primary students and school-age students. Community Care Center will work with the Department of Health on this. We have dental hygienists, and they can work independently on dental education. We hope that we can step up on this front. You mentioned about continuing professional development. We need to equip the dentists and professionals with up-to-date knowledge. We hope to offer a platform for the professionals in the trade to be made aware of the new technology available. That is why we have this mandatory requirement for dentists and dental care professionals, so that their skills can be up to date to enhance the overall quality of the service to be provided. I think that we have a shortage of manpower in the dentist trade. Some dentists want to go for specialist registration, and that's a pathway for them. And I'm not worried about the pathways or the future for dentist development. Dr. Jie? For dentists offering service to civil servants, we have rolled out a number of initiatives to retain these dentists. For example, we ask them to continue to serve the government after retirement, and there are some 20 dentists who are serving after retirement age. For dentists who join the government after the 1st of June 2015, they have to work until the age of 65. We're having a year-round recruitment currently for dentists. And we accord extra salary points to dentists with experience. In terms of occupational safety and health, we procure appropriate tools and equipment for the dentist to use to minimize the risk of injury. And we have procured a number of new equipment. For the digitalized X-ray machine that you mentioned, it's been in use in all of the government clinics. To shorten the waiting time for civil servants, since July 2023, we have a pilot scheme on dental care scaling for civil servants to receive scaling service in the private sector. There are some 100 dental clinics in the private sector that have participated in the pilot scheme. We're looking at the participation rate. My apologies. So that more civil servants can benefit. Thank you. I have a very simple thing to say. The Liberal Party support the bill. As mentioned by Ms. Kwok, we're glad to see this amendment bill, and it's rare for a bill to cover so many areas. Over my 20 years in the Legislative Council, that is why I am glad to have participated in the scrutiny of the bill. No need for a reply. Now we move on to agenda item number 2, any other business. On the 2nd of May, Thursday, we don't have a council meeting that day. That is why we will be having a meeting from 8:30 to 10:30 a.m. and then after a 15-minute breaks, we will have another meeting from 10:45 to 12:45, and then on Monday, 6th of May, we will have a meeting at 8:30, going from 8:30 to 10:30, and then after that, we will have another meeting from 10:45 to 12:45. So we will have reserved for 8 hours for the scrutiny of the bill, and we will have another 4 meetings because this bill is very important. We want to expedite the scrutiny of the bill. I hope that members will support the schedule, which is rather tight. There being no other business, the meeting is adjourned. Thank you.